Hi Tina, it's Ryan. This is video F for upper extremity injuries, shoulder injuries exam 1. And what we're going to be doing today is the last of the special tests. So the first two, which is examination of resting posture and kinematics, go together. There's going to be 4 steps and we're going to do them in order. So the first step, I'm going to be examining her posture at rest. So I'm going to ask her to have her arms at her side, neutral position for the shoulders, elbows nice and straight. And what we're going to be looking for the first step is without a load, and we're just standing here and observing. And we're going to be looking for any rounded shoulders, any winging or asymmetry. And then for step 2, we're going to ask her to add load. So we're going to have her press up against the wall with both hands, about 70% pressure. And we're going to take a look also if there's rounded shoulders, if there's any asymmetry or scapular dyskinesia, or that would be, if there are, then that would be indicative of, or might be indicative of scapular kinesis. You can hop on. So moving on to step 3, this time we're going to be performing either 5 reps of flexion or abduction with our thumbs facing up and a 3-second count on the way up and a 3-second count on the way down. So step number 3 is going to be doing this motion without load. So say she did that up and down 5 times. And then step number 4, we're going to be adding weight. So for the weight, to choose the correct weight, if the patient is less than 150 pounds, then we're going to be using a 3-pound weight. And then if a patient is over 150 pounds, we're going to be using a 5-pound weight. So here's our weight, handy dandy weight. And I'm going to ask her to repeat those steps with weight this time. And we're going to be looking for any shoulder hiking or medial border winging. And then, so say she did 5 reps there. So we would send her off to practice, because we ideally want to do step number 5, which is to repeat steps 1 through 4 after functional fatigue. So we'll send her off to practice and then redo all of them and pretend I redid all of them, and then I'll be looking for any shoulder hiking or medial border winging. The next test we're going to be doing is the scapular assistance test. So for the scapular assistance test, I'm going to first ask the patient to either be standing or sitting, whatever they prefer. I'm going to say she's standing. And I'm going to ask her to perform her own bout of either flexion or abduction. So can you please raise your arm either out in front of you or to the side? Perfect. Thank you. Next, what I'm going to be doing is I'm going to be providing support. So one hand is going to be on the clavicle and scapular spine. The other hand is going to be on the inferior border of the scapula, and I'm going to assist with that tilt, posterior tilt, and upward rotation. So I'm going to slightly glide, like so, the inferior angle, and I'm helping her with that motion. If pain is diminished or range of motion is increased from that first initial observation of flexion or abduction, then that could mean that's a positive test and scapular mobility may be compromised. The last test we're going to be doing is the scapular retraction test. For this one, they can either be seated or standing, and I'm going to ask her to have her arm in 90 degrees scaption, internally rotated, so that means thumbs facing down. And I'm going to first ask her to try to push her scapulas together, her shoulder blades together. This is also like retracting the scapula. And I'm going to provide a downward pressure on the arm like this, and I'm going to be noting strength while she's trying to maintain that position. And then next thing I'm going to do is I'm going to provide assistance. So I'm going to provide assistance while also having a downward force pressure like this. And I'm also going to note strength there. If there is improved strength when I'm providing scapular support, that could be a positive test, and that could mean that there may be something scapular muscular injury of some sort.